Hi, this is my process speech, and here's my audience. Phlebotomists play an important role in the healthcare field today. There's been an increase in infections and disease in the last 20 years, and testing blood is crucial for doctors to diagnose and treat these problems. Phlebotomists should be fully trained and feel confident in their ability to obtain an accurate and viable blood specimen. We need to be aware of protecting the patient's safety and their privacy, as well as practicing the universal precautions to help minimize the spread of infections. Today I'm going to demonstrate a proper venipuncture technique. Alright, the first step that you'd like to do is review your test request. This will let you know, you need to look at your patient's date of birth and what kind of tests you're going to need to run and how much blood you're going to need to obtain. Then you're going to identify your patient and prepare them for the blood draw. Next, you would verify latex sensitivity and dye restrictions, and after that, you need to sanitize your hands. Next, you're going to need to do the tourniquet and locate a vein. Ask your patient to make a fist. Hiding on me. Once you find the vein, you need to disinfect the site and let it air dry. Now, while it's air drying, you need to let the tourniquet off, because you're not supposed to leave it on more than a minute or two, and you need to get your equipment ready. Next, I'm going to put on my gloves. Okay, after the site has air dried, you reapply the tourniquet and ask your patient to make the fist again. It's hard with these gloves. I'm going to give it a second to let the vein poke up so you can see it. Next, you need to uncap your needle, inspect it, and make sure that the bevel is up. Could you hold this for me, sir? Alright, you grasp your patient's arm and you anchor the vein. This is pulling the skin down. Then you insert the needle. Next, you would put the tubes in and establish blood flow, which I have not gotten. Oh. Now, once the blood flows, you need to release the tourniquet. Let the tube fill. Mix it. Place the gauze over. Pull the needle out. Always cap the needle as soon as you do. This is universal precaution, prevents needle sticks. Apply pressure. Now throughout this, you need to make sure that you concentrate on your patient so they're not passing out or getting sick or anything like that. You apply pressure. Now you want to label the specimen right in front of the patient and make sure there aren't any special directions for taking the specimen to the lab. After the blood draw, you would put a Band-Aid on, thank the patient for their time, and disinfect your hands immediately and dispose of the needle in the proper place. the venipuncture. And in a few months, I'll be out there in the healthcare field on my own working. And I want to try my best to follow the protocols and guidelines to ensure that I'm protecting my patient's safety as well as privacy, and always practicing universal precautions so I can minimize the spread of infections. Thank you.